Hi, folks. Welcome to Your Quality of Life Healthy Alternatives. I'm Dr. Christine Sauer, and I'm very excited to have today Dr. Abbas Zawar. Welcome, Abbas.
Thank you. Thank you so much. Thanks for having me.
I'm excited to have you here today and talk about precision medicine. Now, to start, Abbas, let's tell us your story. I know you live in Canada, but how did you get here? And what did you do before? And what are you doing now?
Okay, sure. I have a medical background, and I have been as a family doctor for almost 15 years in my back home in Iran. And also I was involved with other domains of, for example, clinical research, health management, and the other domain of healthcare system. And had the role as a decision support and business intelligence leaders position. And in hospitals or health network, I got my MPH, Master of Public Health in Mental Health and Addiction. Then I moved to that domain, teaching that concept as a doctor. I tried to solve my mental health and addiction problem of my patients in my clinic and also in managerial level. And also I started to get my PhD in alcohol abuse for the first time in Iran. As you may know, my country is an Islamic country, so they try to hide and ignore all complication or issues from alcohol. But I started my PhD in that topic. I conducted the first international conference of alcohol abuse in Iran. But unfortunately, I couldn't finish my PhD because I came to Canada 2015. I had lots of accomplishment, but the most significant accomplishment I want to say, I founded the first preventive medicine institute in Iran.
Wow.
And I grouped lots of genius and talented people, healthcare professionals, to start some approaches for preventive. And it was the first time I was introduced with precision medicine concept, but more preventive part of them. Yeah.
Now, Abbas, why have you changed your avenue now to digital health?
Yeah, good point. So you are a doctor like me as an IMG, and we know that getting the Canadian medical license is a very tough way. My wife is physician as well. She wanted to go that way, so I believe that one person would be enough for each family. So I looked for alternative pathway and searched around, talked with expertise, and I realized that digital health or health informatics is the future of health. It's a growing field. There are lots of opportunity, organization, hospitals, initiatives working in this field. So, and because I had a little familiarity with this environment, so I choose this pathway. I started from a certificate at Ryerson University, moved to master program at University of Toronto, working with several companies as a clinical data scientist or consultant. And I'm teaching in the same master program right now.
That must be so exciting.
Thanks.
How did you get into precision medicine, and what the heck is it?
Yeah, precision medicine is the ultimate goal of medicine. Right now, our medicine, even Western or traditional, is based on the evidence base. We have some clinical research, we found a solution for a specific issue or problem in our health system. Then we advise that solution for all population. But it usually works, but not perfectly. Precision medicine, if we include all data about each person, not only health data, genetics data, social data, behavioral, environmental, lifestyle, everything, then we can customize, tailor, or personalize our clinical intervention for each person, or very a small group of persons that they are really similar to each other. This is the precision medicine. Maybe in past it's out of our mind, but right now we have enough technology and cloud analysis, AI, machine learning, all of those stuff. We have it in other business sectors, so we can use it in the healthcare system and included all of this data, analyze them, and providing precision medicine.
So basically what it would mean is an universal data collection, feed that in artificial intelligence networks, and then try to determine by some computer algorithm what's best for an individual.
Exactly.
So it's basically the modern scientific computerized version of individualized medicine.
Yeah.
Okay, I think I understand what it is. Now let's ask you, what do you see are the advantages of precision medicine for patients?
For patients, good question. Precision medicine has two different aspects. One treatment, one prevention. Definitely, as I mentioned, for example, for all diabetic patients, maybe type 2 diabetes, for the first line, we recommend this kind of medicine for all of them. If it works, perfect. If not, we will go to second line, not go to the third line of medication.
Right.
So our patient need to accept this challenge of with this treatment, evidence-based treatment. If we provide them precision medicine, you are a diabetic patient, but you are a smoker, you don't have enough activity, you are this social level of a status in your community, you have this behavioral, you have this kind of mental health status. All of this, in those 5 medications for all diabetics type 2, the 4th one is the best for you. So I don't need to start from the first one as a doctors. Also, in prevention component, it's my favorite one, because then precision medicine, because we have this holistic information, we can identify risk factors, even nobody know about myself, about genetic, environment, lifestyle, everything. And then based on our guideline, okay, Abbas is at risk of coronary artery disease without any sign and symptom right now. Wow. So what would be the personalized clinical intervention for me to prevent coronary artery disease happen in the next 10 years for me?
Okay.
So this is amazing one.
Where do you get all those data from?
Yeah, this is that my research right now. I'm looking exactly, try to find this answer of this question in Ontario of Canada. With a group of my students, we are looking for exactly, we need genetics data, health data, lifestyle, and environmental. How many of these data are available? Who is generate this data? Most of them are siloed in a specific organization or company. We don't have enough data sharing. But there are lots of problems, but we know that who is general, most of them is coming from hospitals, healthcare professionals, laboratory. The other one, they are generating data, but definitely it's not enough. Yeah. For example, we need the social surveys, my smartwatch, my phone, they are collecting data and I need it for precision medicine.
Okay. Now let's stick with the advantages. We get to the other part later. Do you see any advantages of precision medicine for healthcare providers?
Yeah, I mentioned that right now we each clinicians or doctors, they are facing huge data for patient, and they need to analyze it based on their mindset algorithm to find the best approach. So even we have huge data, but we have lots of lack of data for clinicians to support them to make a better decision. Precision medicine provide all required data at the point of care and providing a best recommendation for clinicians. And clinicians then, by having those personalized data, then they may make a better decision and the best decision for each person or patient.
Okay. Now, are there any cost efficiency in precision medicine?
No. At the end, yes. Right now, maybe using this technology, cloud, AI, all of them is expensive to catch that point. But when we create the solution, definitely it would be cost effective. Always prevention is cost effectiveness.
Oh, prevention is the best medicine. It always.
Exactly.
And what we can prevent, I don't think anybody would disagree with that we should prevent what we can prevent. Now,
exactly. So
yeah, go ahead.
Yeah, I just mentioned prevention is the best cost effectiveness solution. And when we are also in treatment portion, when we customize our clinical intervention, we prevent comorbidity, complication, wrong intervention. Indeed, we exclude those errors. Definitely, it would be cost effective.
All right, now let me ask you, I heard you mention several times that precision medicine can support the doctor or clinician make better decisions for the treatment of a patient. Now, people will argue, who makes those decisions? Shouldn't it be the patient making the decision for themselves?
Yeah, why not? When we have this data and we have this technology, we can provide clinical decision support for healthcare professionals, or as a very simple application, we can provide this information for patient themselves.
Yeah.
Okay, this is your data. This is your risk factors. This is the recommendation. Okay, go and talk with your doctors. This is some recommendation for you, only for you. This is very customized one.
Many people always, and I'm one of them, say that it should be patient-centric, which I think you mean that it should be. That means in the end, every person makes a decision for themselves, and the doctor is an advisor, an educated support, telling the patient, this, in my opinion, would be the best for you. But it should be always followed by, what do you think?
Exactly.
You know that as a family doctor, you did that all the time.
Yeah.
Now, there will be people asking if precision medicine and the collection of that amount of data that are very private data, mental health problems, personal health related data, can't they be used by malevolent parties and to the detriment of people and humankind generally, by bad people, to say it in an easy language?
Yes, why not? It's possible. But yeah, this is the concern, a big concern of privacy and security in precision medicine. But in my opinion, lots of European countries, they pass these privacy issues or culture concern about the privacy. So definitely Canada can follow them and solve these issues as well as a culture or a health literacy.
Yeah.
On the security part, I believe that we have enough technology. If our banking system has very strong security, why health system doesn't follow that?
Now, some people would argue there have been banks hacked and bank vaults broken into with financial consequences. Now, if somebody breaks in a medical database, that could have consequences
Yeah,
that devastate whole
sure.
populations.
Yeah, each new concept, new initiative has
Yeah,
advantages and disadvantages. We need to trade off.
I,
And if you count it, you will find that the advantages of precision medicine would be very bigger than disadvantage. I can't ignore it. Yes,
yeah.
we have to always consider all the strongest security for this very, very sensitive data, but it's possible some smarter people want to trick those data.
Of course, most people want to know exactly what's going on with their bodies and around them. But there are people that value their privacy more than data and are afraid. And you know that from your mental health, there's people that are afraid of everything, including loss of privacy.
Okay.
And I wanted to know from your knowledge in precision medicine and in detail, let's think about an ethical issue. Do most of the people that promote precision medicine support an opt-in model where each patient has to give explicit permission for them to use data?
Yeah. This is the very amazing idea. And as I heard that Ontario and even Canada, they are going to develop a new clinical data strategy, and they are following the same approach, patient-centric. And myself as a patient, I will decide which part of my health data or personal data should be shared with who.
Yeah.
All is based on my decision.
Yeah.
So if I convinced enough precision medicine is good for me, then I will let you know you use my data.
Sure. And I fully support that. I mean, it is certainly an interesting future for medicine in our computer age to use artificial intelligence to help with different difficult differential diagnosis that often regular doctors just don't think about because it's way too rare or complicated. And that's a big advantage.
Yeah, for sure.
I know there is still a percentage of people that would say, will there be some kind of coercion? For example, if you don't agree to your data collection, we can treat you under the national health system. That is certainly a concern, and we have seen it. Or will there be a reward, like some provinces gave people rewards for COVID vaccines, which is a form of coercion, whether you like it or not. And some people say it's unethical. What's your opinion about that? Do you see there a danger that there will be benefits attached to giving their information or disadvantages if people opt out? Besides not getting the optimal treatment, obviously.
Yeah, this is very good question, but has hard answer. Yeah, we need to know how much of if we give access, the full access to patient for his or her health data, it make them confused or make a wrong decision. We need to how they clean them as a clinical data scientist, how summarize them and how prepare them for them, and how much they need to have access to that data. Definitely based on the ethical, they have right to have access to their data, but I believe that as a physician, if we provide them the full data, it's not a good effective or effectiveness for them.
Yeah, sometimes it can be overwhelming for some people.
Yes, exactly.
Yeah. Now, say, let's construct a case. Let's say you have a child that has a drug problem. Would you feel comfortable if precision medicine had been implemented with complete data sharing to take it to a doctor therapist, knowing that this diagnosis and all the data around it will be stored electronically and maybe in case of a data breach used against them in the future, even if this event is long in the past, like some people on Facebook posted pictures drinking or anything as them as a youngsters, and then they can't get a job when they're 40 because their employer found the picture. How is that?
This is a very complex topic about the privacy and security. For myself, it's my option to this is privacy. It's my option to share my data with my doctors or not.
Yeah.
And this is the responsibility of doctor or company or organization security to secure that data. This is very trade-off. It's not always 0 or 100. This is a range.
Yeah.
I need to evaluate how much I want to share my privacy information and how much I can trust that organization is secure for my information. Like, for example, the genetic data is very, very sensitive data for precision medicine, but there are lots of people, they trust some companies, they give them their sample, they analyze all genetics and recommend them preventive or treatment. So I trust that organization. I know that they are really secure.
Yeah.
So this is very based on the range, how much I want to use my privacy and security. I think so.
That absolutely makes sense. And the sensitivity of each person is different.
Yeah.
Wow, that is a fascinating topic. It is really fascinating. But how is it with the data preservation? Would it be possible, even between doctors, that when they see 20 years ago somebody was addicted to whatever, then go back and say, oh, that's an addict? And some doctors are people. There's good doctors, there's doctors that have not so high ethical standards, to say the nicest. I hope I don't meet many of them. I haven't. Most very fine people. But say somebody says, oh my God, that's an addict. I don't even want to treat them. What do you say to those issues? Would there be an option to remove all the data from your information? Would that be even possible? If, say, somebody grows up and says, well, I've grown up, I've changed my mind, I want all my healthcare data removed. Is that a possibility even?
If this is a good question. And if right now we are going for patient-centric or individual-centric data, and we let them know to control their data, I believe so it would be possible in future.
I think that would be an important feature that many patients would be looking for. Who owns their data? It always should be the individual. Yes, you give the doctor and the computer access to it to analyze it for your benefit and not for the benefit of some third party.
Yeah, right.
And that is important. And I think that's a question that most people ask about that kinds of medicine, which is, of course, very new, that everything nowadays is controlled by computers. And it's not that long ago that George Orwell wrote the classic 1984 with Big Brothers watching you and painted a horror scenario. I hope will never come true. And so it's really fascinating. So what is in the future of precision medicine? What's coming up in the next weeks, months, years? What do you see coming up?
Yeah, not as a real precision medicine to include all of those data I mentioned, health data, genomics, lifestyle, social behavior, everything. We don't have that solution right now. I couldn't find it in any country. But lots of company and organization, they are touching one portion of this because this is a huge one. Some companies, they are just working on genomics data. The other one working on imaging report data, or the other one. We have a huge solution related to precision medicine, and at the end, all of them should be integrated. Yesterday, I heard one of them. It's a really amazing one. Maybe nobody think about it. A company in Ontario, I believe so, they have an AI solution to get your EMR data and EMR, electronic medical record, from each physician and try to search on that data to find rare diseases. And they found that between 5 to 10% of patients of each doctor, they have rare diseases and nobody can diagnose it. But this AI find them and report to that doctor and send back all data to that doctor. They don't use it. They just implement the AI on the EMR. They find patient, report it, and done. Wow. Really secure and very fascinating. It's amazing.
Fascinating. So rare diseases are really not that rare.
Yeah, exactly.
That's what I always thought as a physician myself, because I saw those rare diseases that are supposedly to be rare.
Yeah.
So that is fascinating because they are mostly overlooked, because in healthcare, at least in North America, doctors learn when you see hoof prints, look for horses, not zebras. So there's oodles types of zebras. And if artificial intelligence can look at the whole herd and say, here's that kind of zebra, look for it. That is very helpful for the physicians, of course, but even more for the individual that is affected by it.
Exactly.
So I understand your fascination with that kind of medicine, when you really can help make very difficult determinations that then lead to clinical consequences, because that may be something that needs to be treated differently.
Exactly.
And that is a big hope and a big positive. So what do you see as a timeline when something like that, the beginnings, will trickle in medical practice in reality?
I wish I could say very soon, but I don't think so. At least in Canada, we have lots of challenges with policy, agreement, consent, who is the real data owner. We are still challenging with these issues. But I really hopeful we can get it hopefully by next 10 years.
Next 10 years. Okay, I might see that. Yeah, well, I'm only 60. I plan on being alive and well at 17.
Okay, perfect.
I'm looking forward to
You can do it, for sure.
Abbas, it was a pleasure having you on your show.
Thanks for having me.
And all the best for you and your wife and your family for your future here in Canada.
You too. Thank you so much.
Thank you. Bye-bye.
Thanks. Have a good day.